video of me changing my G-tube, and my J-tube came in the mail, so I'm gonna change my J-tube now. So here we have the J-tube, Kimberly Clark, 14 French by 2.7 centimeters. Yours could be a different size. The procedure's still the same. I already opened the box, so let's just take the box out. Inside the box, you have your standard feeding tube kit. Come look at this. Okay, so in here, there's 2 syringes, the J-tube low profile Mickey button, and 2 feeding extensions, a right angle extension and a bolus extension. So we're gonna change the tubes. First, sanitize your hands, always first thing. And supplies, you need your kit, empty syringe, full saline syringe. You will open your kit up and there's these gauze things. You can use them if you want to or not. I just use them to sort of catch any leaks or spills that can happen. So remove the tray. This is all the accessories. Here's the tube in here. As you see, it's really, really long. You always pay attention to your doctor's recommendation, but my doctor cuts mine. I'm gonna cut mine too. This is scissors. They're sanitized, not sterilized. I don't have problems with infections. I've never had an infection. Always pay attention to what your doctor tells you to do. So I'm gonna cut about half of this off because I don't need it to be this long. Okay. So that just goes in the trash. So now you take your empty saline syringe and deflate the existing J-tube Mickey button. And you just attach the syringe to the balloon port that's on the side. It says BAL for balloon. You push it in. Doesn't latch on like a regular syringe or IV line, but it should, the force of the balloon should push the saline into the syringe. If it doesn't, you can draw back on it, but your balloon, if you're changing it, might also be ruptured, so there might not really be any saline in it to begin with. So we're going to check that. I'm going to put it in the port and twist it. And I am getting saline out, but it stopped. And I only got 2 cc's out, which makes me think that my balloon is leaking. Which makes sense because they sent me a new tube to change. So this is the old saline water. We can just throw that away too. And this is the old tube, so nothing's holding it in. Put the gauze. And so you can just pull it out. You might get a little bit of resistance, but it should come out pretty easily. There. Okay. So, look away, you have a weak stomach. As you can see, my feeding tube is fairly clogged. So that also goes in the trash. And put the gauze to hold any spills that could happen. But we put the new feeding tube back in. It looks just like a G-tube from the outside, but it does say jejunal access on it. Can you zoom in? Do you see that?
There is no zoom, but...
No. Can you see it? Can you read it?
I think, yeah, it looks pretty... Okay.
Okay, so jejunal access, that designates, in case you couldn't explain that to somebody, this is where your feeding attachment would go in. This is how you inflate the balloon. So, I'm leaking. Gauze change. Okay, so we just put the J-tube into the stoma because I'm leaking pretty bad. And it just goes in like the other G-tube except the tube's longer. You might be wondering why I'm not wearing gloves. I did sanitize my hands. I didn't sterilize them. Changing feeding tubes doesn't have to be sterile. It just has to be clean. So as long as your hands are clean, everything it's touching is clean. Similar standards that you would use as if you were actually eating something. So I'm just feeding the tube in past the balloon at least. And for some reason it's a little bit tight going in. There. It might bleed a little bit. That's totally normal. You can wear gloves if it grosses you out, but it's my blood. It's my whatever. I don't get grossed out. Okay, so the tube is all the way in, but there's nothing holding it in. So I have to inflate the balloon with the new saline syringe. Basically the same procedure as deflating the balloon. Attach the syringe to the balloon port and put in about 2 to 5 cc's of saline. Standard, I think, that the balloons hold is 5 cc's, but use your own personal preference. You can feel it getting tighter, but you don't want it to be depressing against your skin. That could make an ulcer or irritate it. I put about 3 cc's in this one. As you can see, it's totally in. Can't fall out.